Patellar tendinitis, commonly known as jumper's knee, is an overuse injury affecting the patellar tendon, the structure that connects the patella kneecap to the tibia shin bone. This condition is most frequently observed in athletes who participate in sports that involve repetitive jumping, running, or sudden directional changes, such as basketball, volleyball, soccer, and track and field. The patellar tendon plays a crucial role in knee movement by transmitting forces generated by the quadriceps muscle to the lower leg, allowing for proper knee extension and power during activities like jumping, kicking, and sprinting. When excessive stress is placed on this tendon, microscopic tears can develop, leading to pain, inflammation, and progressive tendon degeneration. Without proper management, patellar tendinitis can worsen, potentially leading to chronic pain and long-term functional impairment. The development of patellar tendinitis is typically due to repetitive mechanical overload, which causes microtears in the tendon fibers. Over time, the body attempts to repair these microtears, but if the stress on the tendon continues without adequate recovery, the healing process becomes impaired, resulting in chronic degeneration rather than inflammation. This degenerative process is known as tendinosis, where the tendon fibers become disorganized, weakened, and less capable of handling load. This transition from acute tendinitis inflammation to chronic tendinosis degeneration explains why many cases of patellar tendinitis persist despite rest and traditional anti-inflammatory treatments. Several factors contribute to the development of patellar tendinitis, including intrinsic and extrinsic risk factors. Intrinsic factors include biomechanical abnormalities such as patellar malalignment, excessive foot pronation, and muscular imbalances. Weak quadriceps and tight hamstrings or calf muscles can alter the distribution of forces through the knee, increasing strain on the patellar tendon. Poor flexibility in the lower extremities reduces shock absorption, causing greater stress on the tendon during activities involving repeated impact. Extrinsic factors include excessive training loads, sudden increases in activity intensity, inadequate warm-up, and playing on hard surfaces. Improper footwear and poor movement mechanics can also contribute to increased tendon stress, exacerbating the risk of injury. The hallmark symptom of patellar tendinitis is localized pain at the front of the knee, just below the kneecap, where the patellar tendon attaches to the tibia. Initially, pain may be mild and only present after intense activity. But as the condition progresses, discomfort can become more persistent and occur during everyday movements, such as walking, climbing stairs, or squatting. The pain is often described as aching or sharp, particularly when applying pressure to the affected area. In more advanced cases, swelling and thickening of the tendon may be noticeable, and individuals may experience stiffness and reduced knee function. Unlike ligament injuries, which often present with instability, patellar tendinitis is primarily associated with pain and functional limitation, rather than joint instability. The diagnosis of patellar tendinitis is primarily clinical, based on patient history and physical examination.
Physicians typically assess pain levels,
functional limitations, and contributing biomechanical factors. Specific tests, such as the single leg squat or decline squat test, can help reproduce symptoms and confirm the diagnosis. Imaging studies, such as ultrasound or magnetic resonance imaging, MRI, may be used to evaluate the extent of tendon degeneration,
identify areas of thickening or microtears, and rule out other conditions,
such as patellar fractures or bursitis. Ultrasound is particularly useful for assessing changes in tendon structure, while MRI provides more detailed visualization of chronic degenerative changes.
Treatment for patellar tendinitis is aimed at reducing pain, promoting tendon
Healing and restoring normal function. A graded rehabilitation program is essential for recovery, as rest alone does not adequately address the underlying causes of the condition. Initially, the RICT protocol rest, ice, compression, and elevation may be used to manage pain and inflammation, particularly in the acute phase. However, prolonged rest is not recommended, as it can lead to muscle atrophy and stiffness. Instead, a modified activity approach is encouraged, where high-impact activities are reduced, but low-impact exercises such as swimming or cycling are maintained to preserve cardiovascular fitness. A progressive strengthening program is a cornerstone of patellar tendinitis treatment. Eccentric exercises where the quadriceps lengthen under tension, such as slow, controlled decline squats, have been shown to be particularly effective in promoting tendon remodeling and improving load tolerance. These exercises help stimulate proper collagen alignment within the tendon, reducing pain and improving function. Additionally, strengthening the hip abductors, core, and calf muscles helps improve overall biomechanics and reduces excessive strain on the knee joint. Flexibility and mobility exercises play a key role in treatment by addressing muscle tightness that contributes to tendon stress. Regular stretching of the quadriceps, hamstrings, and calf muscle helps improve knee mechanics and reduces excessive pulling forces on the patellar tendon. Foam rolling and manual therapy techniques may also be used to alleviate tension and enhance tissue mobility. In addition to exercise-based rehabilitation, orthotic support and bracing may be beneficial for individuals with biomechanical abnormalities. Patellar straps or tendon braces help redistribute forces across the knee joint, reducing strain on the tendon and providing symptomatic relief. Shoe modifications, including cushioned insoles or stability shoes, can help correct foot alignment and optimize shock absorption. Pain management strategies include nonsteroidal anti-inflammatory drugs and SAIDs for short-term relief, though their long-term use is discouraged due to potential side effects and their limited effect on tendon healing. Corticosteroid injections are generally avoided in patellar tendinitis, as they may weaken the tendon and increase the risk of rupture. Instead, newer regenerative therapies, such as platelet-rich plasma (PRP) injections and prolotherapy, have gained attention for their potential to promote tissue healing and reduce pain in chronic cases. For individuals with persistent symptoms despite conservative treatment, shockwave therapy has emerged as an alternative non-invasive option. Extracorporeal shockwave therapy (ESWT) delivers mechanical energy to the affected area, stimulating blood flow, reducing pain, and promoting tendon healing. Some studies have shown promising results in improving function and reducing pain in patients with chronic patellar tendinitis. In rare cases where conservative treatments fail, surgical intervention may be considered. Surgical options include debridement of degenerated tendon, tissue, release of excessive tension, or, in severe cases, partial tendon resection. However, surgery is generally reserved for refractory cases that have not responded to extensive rehabilitation. Preventing patellar tendinitis requires a multifaceted approach, including proper training techniques, adequate recovery periods, and attention to biomechanical factors. Athletes and active individuals should gradually increase training intensity. To avoid overloading the tendon, strengthening and flexibility programs should be incorporated into regular training to ensure balanced muscle function. Proper warm-ups and cool-downs before and after exercise can help prepare the tendon for activity and reduce the risk of injury. Wearing appropriate footwear that provides adequate support and cushioning can also play a significant role in injury prevention. Patellar tendinitis is a common yet manageable condition that affects athletes and active individuals who engage in repetitive knee-loading activities. While the condition can be frustrating and persistent if not addressed properly, a well-structured rehabilitation program focusing on progressive strengthening, flexibility, biomechanical correction, and load management can lead to full recovery. Understanding the underlying causes, recognizing early symptoms, and implementing appropriate treatment strategies can help individuals regain knee function, return to sports, and prevent future episodes of patellar tendinitis. Ongoing research into regenerative treatments and rehabilitation techniques continues to improve outcomes for individuals suffering from this condition, offering hope for more effective and long-lasting solutions.